already showing. Thank you, Mr. Chair.
Dr. Paul Hutchison.
Wow. Thank you, Mr. Chairman, for the opportunity to speak on this very important financial review. And I must say that I'm very proud to be able to speak of National's record in health. This is, and we see the Labour opposition. We see the Labour opposition, and we look at their record. They were the very ones that culled tens of thousands of patients off the waiting lists. Right. Tens of thousands of patients. That was a bad record, and that record is very well evidenced. In sharp contrast, in this financial year, there have been over 129,000 elective operations carried out. That's 11,800 more than the previous year, 11,800 more than the previous year, and many thousands more than in any of the previous 8 years under the Labour government. One of the things that distinguished the Labour government was the dismal productivity in the health sector, and that was borne out very clearly by a series of papers written by the Treasury. After all, they did inject money into it, but there was no evidence of an increase of output. Clearly shown in the area of elective surgery, and clearly shown when they culled, not reprioritised, they culled tens of thousands of patients off the waiting list. So when we have this Labour opposition talking about cuts, they've just got to look back at their record, which was a particularly dismal one when it comes to health. And, Mr. Chairman, one of the things that I think is important to emphasise is that the health system that they had put in place was totally inappropriate in terms of the duplication, the poor local, regional and national planning and performance right around the country. And that's one of the great achievements, again, that's occurred with the formation of the new National Health Board, because it is indeed providing the leadership required to manage that $9.7 billion that funds the 21 DHBs. It is indeed extraordinarily timely. And I think, Mr. Chairman, it is important also to comment on the significant report called In Good Hands to guide district health boards in introducing greater clinical leadership into the public health system, because clinicians, doctors and nurses throughout the country have absolutely regarded unanimously as the very sort of thing that should happen after 9 years of being shunted out of frontline services in the New Zealand Health Service. Mr. Speaker, one of the other very interesting things that has happened recently, of course, is the publication of a simplified health target system. We had under Labour target after target. We have strategy on strategy, and they just didn't know where they're going. And I note in the Dominion Post this morning, the editorial said public comparisons boost performance. One thing is for sure, in the wake of the publication of Health Ministry statistics comparing the performance of 80 primary health organisations, Total Health Care Otara, the PHO, with the poorest record of immunising 2-year-olds, will be taking immediate steps to improve its performance. Public ignominy is a powerful motivating tool, so it should be. The release of the data highlights yet again the benefits of comparing the performance of organisations doing essentially the same job, whether they operate in the health sector, the education sector or in any other area. And Mr. Chairman, that has been one of the problems of the previous Labour government. They have not been transparent. They have created huge bureaucracy. They have failed to bring evidence out into the public. And here we're seeing before us one of our major papers saying this is good. They've hidden, they've balked against it in education, but the health fraternity is saying yes, this is great. The DHB have lauded it, and so have the primary health organisations. This is a great change, Mr. Chairman, under the national government. Now, Mr.
Order. Are you seeking another call? I rang the bell.
Apparently not. I'd like to, but I won't. I'll bow down.
So we're enjoying it.
Well, I will then put the question, which is that the report on the Health Committee on the 2008-09 financial review of the Ministry of Health be noted. Those of that opinion will say aye. Contrary, no. The ayes have it. I understand that the next financial review members wish to debate is the financial review of the State Services Commission. Question is, I'll just read the question, that the report on the Government Administration Committee on the 2008-09 financial review of State Services Commission be noted. Grant Roberts.
Thank you very much, Mr. Chair. What the financial review of the State Services Commission tells us is that the government actually doesn't have